So most welcome, and today we are glad to host Dr. Eric Geshane, and we shall be discussing all about matters of pharmaceutical industry in Kenya, regulation, policies, and so many other things of interest to the nation and the community in general. So without much further ado, kindly allow me to introduce Dr. Eric Geshane. Karibu sana.
Asante sana.
Maybe you can tell us who is Dr. Eric Geshane as we kick off.
All right. So thank you so much for the opportunity to be here with you today and educate the public. My name is Eric Geshane. I'm a pharmacy professional, and I'm glad to have served in several settings in the pharmacy sector, from community pharmacy, hospital pharmacy, institutional pharmacy, and also in the leadership of the Pharmacy Professional Association. We have two cadres. We have pharmacists and pharmaceutical technologists, and we have an association called Kenya Pharmaceutical Association that represents over 12,000 pharmaceutical technologists in the country. So I have been a branch official at the Nairobi branch as the secretary. I have also been, and I still am, the Secretary General for Kenya Pharmaceutical Association. That is nationally.
Wow.
Yeah, so I can now embark on the question you asked. You can come again.
Sure. You can tell us what's the role of KPA in Kenyan pharmaceutical industry?
The role of KPA is an umbrella body for pharmaceutical technologists, like I said. And the role is the advocacy on matters affecting the practice of pharmacy in the country, the welfare of the pharmaceutical technologists, and of course working together with stakeholders like the Pharmacy and Poisons Board, who is a regulator, the Ministry of Health, the county governments, to ensure that there is access to pharmacare for the citizens. So the association has a code of ethics, and the members subscribe to that code of ethics. And when we have members serving or members who are working in the pharmacies being members of the association, we are assured of that they have subscribed to a code of ethics that encourages professionalism and has staff who are competent and who promote professionalism in the healthcare.
Okay.
Yes.
And what's the baseline? What's the distinction between the pharmacist and pharmacy technologist?
Yes.
What's the difference there?
Of course, we have degree holders and diploma holders.
Okay.
So those are the only two cadres that we have in the country.
Okay.
And you'll find we have like 80% of community pharmacies. Community pharmacy is the pharmacy you'll find in your estate.
Okay.
Out there in the town, in cities like that. Then we have also hospital pharmacies. And like 80% of the community pharmacies are owned by pharmaceutical technologists.
Okay.
And we also have pharmaceutical technologists serving in the county governments. In the also hospital pharmacies, we have level 2, level 3, level 4, and 5 and 6. And they are all spread in there.
Okay. Then we have another board that's called the Pharmacy and Poisons Board that I understand has been established under the Pharmacy and Poisons Act.
Yes.
Do you work together with Pharmacy and Poisons Board, or how is the relationship there?
Yeah, we do, because Pharmacy and Poisons Board is is our regulator or the regulator of pharmacy practice and health products. Nowadays we call them health products and technologies because they are drugs, they are also medical equipment and devices, that is, which are the pharmacy board is the regulator for that. So it is the pharmacy board that will set the criteria for running the business of a pharmacy, opening a pharmacy, community pharmacy, hospital pharmacy, all that. So it's the Pharmacy and Poisons Board that regulates the professionals who work or who run those healthcare or pharmacy settings. And of course, the standards of drugs and the medical devices. The board is also tasked to ensure we have the highest standard of drugs, the highest standards of those devices. There is there are labs to keep testing and keep doing some analysis to ensure we have quality drugs in the country.
Okay. And in line with that, what does one require to start his or her own pharmacy in Kenya right now?
Right now, you require to have a pharmacy, to be a pharmacist or a pharmtech. And then you have to apply, of course, get a name from the registrar of societies for your pharmacy. The name is approved. They will request that you also provide proof that as you apply for, let's say, like Eric's pharmacy, I am a pharmacy professional. So they require I maybe upload my license or registration certificate. Then the name is approved and get a certificate for the name. Then apply to the Pharmacy and Poisons Board. Of course, I'll be required to meet a number of requirements that are in guidelines that are set by the Pharmacy and Poisons Board. Number one, the size of the pharmacy, that is the size of that whatever space that you have, you want to do business in. It has to conform to some minimum standards. Of course, there must be running water, there must be washrooms, and then there must be enough space. 24 meters square is the minimum. And then the pharmacy should be designed in a way that there is a dispensing area. There is like a consultation area where you can have a patient and do consultation. Of course, that hasn't been there, but now that's where we are headed to, what we call medication therapy management, or MTM, where you don't just want to dispense drugs like a shop, but you want to do some consultation, do some evaluation of drugs the patient is taking, and then you can advise or you can now do what is required of you. So the pharmacy board is the one that will ascertain that you have met the minimum standards. They will also look at the next or the closest pharmacy. How far is it from you? Are you becoming unworthy, or is it unworthy, or some unhealthy competition? So all that is checked, and then you get an approval. So you will need now when you are a pharmacy professional, of course, because there has to be a superintendent or the one in charge of that pharmacy. And then from there, now if you have other staff, then it's fine, but they must also be licensed.
Okay. So there is no possibility where a medical doctor or maybe a nurse or maybe other healthcare worker or profession can start his or her own pharmacy?
Yeah, right now, no. That used to be there, but because of proliferation of quacks and we call them charlatans, that was put as a measure to reduce anyone who wants to open a pharmacy. An accountant feels the pharmacy is a profitable business, and he goes and opens. Then he gets, he will employ a pharmacy professional, but maybe after some time, that pharmacy professional leaves. Okay. What happens is this guy or whoever, within some time, he may be now the one dispensing.
True.
Yeah, and now we continue creating more quacks.
True.
And that also exposes the public to many other issues on that may arise on such kind of dispensing that is done by non-professionals.
Okay.
So that one, of course, I know for hospitals where there are more than one owner, of course, that can happen. It could be physio hospital, and then there is a pharmacy. It doesn't mean that now because you own the hospital, you can't be allowed to have a pharmacy, but then you have to follow the guidelines. Okay. That pharmacy must be having a superintendent who is a pharmacy professional.
Okay, okay. Yeah. Then we have seen other instances where you find it's a pharmacy and they still dispense human, animal medicine. Is it legally allowed?
It used to be like that some time back because veterinary products were also under the Pharmacy and Poisons Board.
Okay.
But things have changed, and we now have some sort of separation. We have the veterinary board taking care of their products and professionals.
Okay.
But in case we have veterinary products and human medicine, there is a requirement now for that separation, and of course adherence to the laid down guidelines by now the veterinary board and also by the Pharmacy and Poisons Board.
Okay.
Yes, so, but you do not expect that a veterinary officer will cross this side and dispense human medicine and vice versa.
Okay.
Yeah, but I am aware because I have ever worked in a pharmacy that had that. Sometimes that would happen. You find there is a veterinary officer, maybe he's only one, and when he's not there, the rest can maybe do what they need to do. So those are some of the things the Ministry of Health through the Pharmacy Board and the other relevant boards has been trying to streamline to assure safety and quality. Yes.
Okay. So let's move to the next question, which is about self-medication and over-the-counter. In 2016, there was a case of this lady in Muranga who had chest congestion, went to a pharmacy, got a medication, went home, but she didn't give a full history because she had allergy to sulfur. That went ahead to mess up with her body. She lost eyesight and all that. What would you say about this issue of self-medication, especially to the general population? What would you advise them?
Self-medication is really highly discouraged because sometimes you want to imagine the problem you have is the same problem you had last time when maybe you saw a doctor. And therefore, you just feel you don't need to go to a doctor or to seek medical services. You just want to do it yourself. So it happens in many ways. Number one, you could get a prescription today and then you keep it. So it could be running for a week, 2 weeks, a month. Then next time you get the same problem or the same symptoms, you want to use the same prescription.
True.
prescriptions expire. If it is a week, then it should be treated as an expired treatment. I mean, a prescription after that. So that is discouraged because you know it can also hide many other issues, underlying issues.
True.
Even the way we treat even our pain sometimes, it could mask many other issues which would have been identified in a healthcare setup. Then you'll find those who will go to the pharmacy, give me ile dawa yangu.
True. That's what they say.
Yeah, hiyo ndio inafanyanga. You'll find someone taking you know, like it could be what now, like corticosteroids, and they will take for a long time. That would also end up affecting them in terms of maybe their health, immunity and all that. So it is highly discouraged. If you have a problem, go to a healthcare provider and go to a hospital, go to a clinic, get a prescription, and then you now can go to a pharmacy and get medication. Of course, this is more in instances like where we have people who want to misuse antibiotics.
True.
And you will take the antibiotic because it worked on him last time, or it worked on someone else.
True.
Yeah, and then you will find through that self-medication, again, there is a lot of masking of other underlying issues.
True.
Plus, we also increase the burden of what we call antimicrobial resistance. Yeah. So I would really encourage that the public, we stop doing self-medication, and we go to the hospital, we go to the healthcare facilities where we can be assisted. Even mothers, you have mothers who don't want to take their kids to hospital.
True.
They will tell you, I just buy this, I'll just say like Amoxil, because, or I buy this antibiotic and my baby is fine. The baby would be having other underlying issues, which will be controlled for the time being by your self-medication. But if the baby went to hospital, was taken to hospital and had observation by a trained healthcare provider, we have clinical officers, we have doctors, they would be able to identify the best treatment option for that kid. Another thing is you'll have people have flu, which is a viral infection, and they want to go and buy antibiotics. So, and they are the ones doing it as self-medication. The antibiotic won't help you because antibiotics don't work where it is a case of virus infection, influenza virus. So it is just creating a ground for antimicrobial resistance again.
Wow, that's great. That's a great insight. And also onto that, let's talk about the antimicrobial resistance. In 2016, we saw the Ministry of Health coming with a report that we have that problem in the country, and they had the plan on how to mitigate that. I think with the USAID, I think. But currently, I think it's this year we saw a gonorrhea that was not responding to treatment. Do you think these self-medications are what are bringing about these problems of resistance?
Yes, that is it. That is the main contributor to antimicrobial resistance. and it is such a huge economic burden, by the way. I have worked in hospitals. I've worked in Nairobi Hospital, Kichabe Hospital, and I know what it means to have a patient who is not responding to a certain proven antibiotic that would work for his case.
True.
And then he would be taken to another, maybe it's a first line, doesn't work, goes to reserved antibiotics. Just simply because maybe there is that antimicrobial resistance. So it is really a very huge economic burden to the patient and to the also to the government, because those staff are also paid either by the government or the private sector. And we end up now having a patient who will take time in the hospital, admitted, all that. The case of super gonorrhea is also the it has been you know, it's a creation of AMR, or antimicrobial resistance. And I would say most people, when they get those infections, sexually transmitted infections, they know somehow there is some drug, you know, someone who is maybe sexually active, and active in such that he has multiple partners. So the possibilities of getting infection are very high. So he will get an infection today, or whether it's a lady, a gentleman, and then go to the pharmacy, get some drugs. They work. After a week or two, he has another gonorrhea from another partner. Now he won't go to see a doctor. He now knows what he bought last time. So he goes back and gets it. And he doesn't know which strain or type of this gonorrhea now this time. So you'll find someone, some guys, maybe someone is quiet, having an ongoing infection, treating it himself, until now he realizes it's not getting improving. So now they go to a clinic, and maybe they are started on other now different medication. But it is really the contributor to this AMR, because the way it has refused to work on under that particular antibiotic, it's still the same way. It will now become a that super gonorrhea, which you can't just treat with either azithromycin or cefuroxime or whichever, or ceftriaxone, or whichever other antibiotic. So don't just go to the pharmacy and ask for these drugs just like that. Go to the doctor to get some lab tests. Sometimes you may be treating an infection that is really not what you think. There are many other sexually transmitted infections other than just thinking it's gonorrhea.
And in line with that, let's also talk about the opioids, because I don't think it's only the antibacterial, antiviral medications. We also have issue with opioids. There was a report I was looking at too, and it was saying that people who have chronic pain, 1/3 of them end up misusing these opioids even after prescription, while 10% become addicted to these, more than 10%. What do you think should be the approach towards this abuse? Should we stop dispensing this medication without a prescription, or how far should we go to it? Because I was also seeing another article, they were saying even the doctors now have become a culprit to opioid abuse.
The abuse of opioids is also wide in terms of it's the abuse by patients, in this case, maybe someone is not even a patient, is not sick, and also by the healthcare providers. I have seen or have worked with colleagues who have been addicted to some of those kind of opioids. Others will even use the injectables. And then had even cases where one of the staff is found in like the washrooms, has collapsed because they are addicted to these opioids, and they have access to them.
Yeah.
So they will try anything they can do to have it. Some go to the extent of maybe even taking it from their patients, which is really wrong. On the other side of the patient, there is nothing wrong to buy over-the-counter medicines, because we have classification of drugs. We have what we call OTCs, and that's by law. Even if you go to a clothes shop there, you can buy maybe paracetamol, maramoja, or whichever. But now there are those we call controlled drugs, because now they have some dependency level that you may develop. The drug will work for you, but if you use it for some time, you may have some, some dependency. You feel you need it. Maybe it makes you feel a bit what we call a bit high, or
true.
Or a bit relieved or something like that. There are people who even abuse even paracetamol. They just take it. They have no reason for taking it. But they say they feel they are maybe no longer as tired or something like that. And that paracetamol is going through your liver in its metabolism.
True.
Overworking your organs, liver and all that. So if you keep doing that over some time, you might need now to treat something else. The ones that also make people feel that euphoric feeling. I think the the healthcare providers have a role to play. The pharmacy professionals have a role to play. If a patient comes to my pharmacy today for opioids, even with a prescription, like I said, that prescription has a lifeline or lifetime, that is. It is supposed to be like, let's say, 5 days, 2 weeks. That is 14 days, 21 days, whatever the case, depending on what the pain is being managed. But you'll find a patient now has finished, the duration is over. He has come back with the same prescription, or even without. Now he knows the drug and tells you, give me drug XYZ. It's the one that I use. So maybe it was supposed to manage the pain for the duration on the prescription. But now he doesn't want to go back for a review. He just wants to continue with it. So what happens? They get that dependency. And even when the pain is gone, they will still want to use it. Now that's what happens. And it's a big problem. Some will use it because of maybe their social issues and stress and all that. But we need to educate the public. Whatever you take in, there is something it's doing to your body. So if its intended purpose was to help you manage pain, and the pain is gone, then you do not need to keep taking it. If you have a problem with the dependency and that addiction, then go to your pharmacist, to your pharmaceutical technologist near you, to a clinical officer or any healthcare provider, and let them help you on how to get out of it.